Hello everyone, my name is Mary Tobolsky, and today I will be presenting for you a project on physician's assistant. Also, a little disclaimer, my computer fans are being really loud, so if you hear that, just please try to ignore it. So you may ask, if you're unfamiliar, what is a physician's assistant? Well, this is a licensed professional in the medical field, and they will work with patients from all different age groups. They are there to diagnose, along with treat their illnesses and work on procedures that are minor. And specific duties of PAs vary because of certain laws in different states that they may reside in. Also, it depends on who their supervising physician is. Their work environments are clinics, doctor's offices, and even hospitals. So, steps to become a PA. There are quite a few. First, you should have a high school education and a diploma to prove that you graduated. And then after that, you'll go on to college, wherever you choose, and successfully make your way through your career of college and graduate with a bachelor's degree. Also, there are prerequisites before you can get into PA school. So they want you to have a minimum hours of patient contact. Could be working as like an EMT, a nurse's aide, a paramedic, but you're not limited to these, and it really just depends on where you are applying to PA school. So those are just some examples. And then there are courses that you need for prerequisites to be able to be considered an applicant. So you need a certain amount of hours of health science courses, and these could be, for example, a biology lab and lecture, chemistry lab and lecture, genetics. And not just those health science classes, but you also need a statistics course, an ethics, and a general psychology course. And then for grade-wise, for these prerequisites, you need to have either a C or better and an overall GPA of 3.0 or higher. So then after you have all those prerequisites, you will go through PA school once you get accepted, if you do, and you will have to obtain a certain number of credits, depending on what school you go to. And after that, once you complete everything successfully, you will get your master's degree. And then after you graduate and you receive your degree, you will qualify to take the PANCE exam. This exam basically covers like everything that you should have learned throughout your regular college and then your PA school. So this exam, if you want some examples, basically covers like diseases, disorders, organ systems, and also assessments. Those are just some examples. And this exam, there's 6 tries within a course of 6 years. And once you pass, you must have a state license for where you live and where you will be practicing. And in order to keep your certificate, you need 100 education credits every 2 years. So basically, you need your bachelor's degree, then you need all those prerequisites for PA school, and then once you get accepted, you'll go through school, which is usually about 2 years, and then you get your master's degree. After that, you will take the PANCE exam, and hopefully you pass. That's the goal. And then you just basically have to maintain your certification and any other additional certificates that you might need. So, for my next slide, there are many different paths that one can take as a PA and several specializations to choose from. And these are just some I have. For example, dermatology, thoracic surgery, critical care, trauma surgery, emergency medicine, addiction medicine, cardiovascular surgery, family medicine, pathology, and pediatrics. There are more, but these are just a few examples, and you're not just limited to these. So next we have skills. I have a list of 1 through 5. So after you're done with your master's, physician's assistants, these are like the skills that they expect you to have. So number 1 is clinical competence. PAs should be able to solve the needs of those in hospitals and other medical settings, and they must be able to know how to handle all types of needs that come from their patients and any situation that may be thrown at them. Number 2 is communication skills. This is obviously a basic and obvious one, and I feel like in any type of field that you are in, you will need this one as well. So having effective communication skills is crucial since they have to talk to patients and fellow colleagues. Number 3, operational management. PAs are responsible for taking care of overseeing operations, and therefore it is essential to have these organization and operational management skills. You must be on top of things, be able to time manage, because if you cannot have this skill, then you're going to be in big trouble, especially when you're on your job. Number 4 is adaptability and flexibility. So a PA must be able to adapt since their days can be very stressful, and obviously every day is not the same. They must be able to work flexibly and effectively in any situation, including emergency visits. Number 5 is service-oriented. So they must approve every day of their job with this mindset, and they need to provide excellent service. You always got to be on top of things, think the best outcome. And if you're wondering how these skills are developed, it's through clinical rotations and hands-on experience. So these are just some fun facts and basic facts that I feel like people should know. So PA is number 2 in best healthcare jobs. If anyone was curious on a median salary, is $115,390. This was recorded in 2020. If anyone's wondering stress level, it could be above average, flexibility above average, upward mobility average, and then the best paying states include Alaska, Connecticut, Rhode Island, California, and Nevada. So I feel like people might have the question, like, is this profession in high demand? Well, according to one of the websites, Public Health Records actually, this profession is predicted to grow 72% by 2025. And that's not that far away. And in my honest opinion, I know a lot of people that are interested in physician's assistant, and I know like other people in this course also are interested. So I can definitely see this profession growing at a rapid rate, considering the spike in interest. What interests me about a physician assistant? Well, I like how there are many different specialties that you can go into and still can be considered a PA. However, depending on what you choose, you may have to put in more time to be qualified for that certain area, but that's okay. I also like how they're also one step down from a doctor and are basically capable of almost doing everything they can. And I also think that some jobs, after a while, they'll get boring. You might not be interested. But I think every day on the job would be so different from the next, so it would never get boring. And on this slide, I have some additional references that if you want to check out, we have one that's .org, and then the second one is .gov. And then these are my references that I used for my presentation. And that is all. Thank you for listening.